We are back on Adults Class, and this is me and myself, Mr. Smooth. My shirt was given to me by Ish Boutique in Medina. If you are from Medina, the market, you're heading towards Hannah School Complex. There's a boutique there. Ish, thank you for the shirt. And I called Fletcher, saw it and was like, I love this shirt. Yes, and I'm sure
it's just a real beautiful.
Yes. I mean, thank you.
It actually looks good on you.
Yeah, thank you. And I think I see my pot belly is coming too. So anyway, we're still looking for sponsors to sponsor this Adults Class show, because we really need to get sponsors to keep this show going. So if you're out there, you want to keep this education going on, please help us get some people to put some money into keeping this show going. I keep saying that Adult Class is the most educated show in the whole of this country, and until you're finished watching what we have to do, you will never know. But now I'm sure you can tell. Now, last week we were looking at the vaginal dryness, and we said that some women have issues with vaginal dryness. The cameraman, come, let's start our presentation. So yes, I'm calling him. All right, so we are saying that when you have vaginal dryness, there are some symptoms, and some of the symptoms that you'll be having will be soreness. You feel sore under you. You feel pain under you. You feel some itching under you. You feel some stinging under you. I mean, when the place is dry, you feel it, and then you feel this burning sensations, and then around the vulva and sometimes inside you feel some burning sensations, especially when you're having intercourse. It becomes a little painful. We call that painful intercourse, and all these are part of it. And then sometimes too, you start experiencing light bleeding. You'll be bleeding while, or probably immediately after sex, or probably while having sex. You see yourself having some blood clots and stuff like that. You'll be bleeding while you're having sex. And then also, you would also have some mild vaginal discharges. Some of them you can even experience the thinning of the vaginal wall, which can also become a sore, which can eventually turn into an atrophy. So it's important that you treat yourself so you don't have these symptoms. And then also, when you have vaginal dryness, the place becomes numb. You won't feel anything. Your libido will go low. Your estrogen levels will drop, and also you start having inflammations in the vagina, and then your place becomes susceptible to infections. You can easily get infections or pick up infections from wherever you get to, and some of these infections you can pick up could be urinary tract infections. And then once you treat these urinary tract infections, they keep reoccurring. So if you are treating your UTI and then they continue to reoccur, it's simply because you may have vaginal dryness that you need to treat. And this, like I said, is treatable. And if you need treatment, it's available. There's this myth that we have all grown up to probably accept that it's normal. You have been told not to put anything there, especially the women. I mean, growing up, they've been told not to put anything there. Now everybody knows, or every woman growing up knows, that the place is self-cleansing and the place protects itself, because the place tries to keep its acidity and maintain its form, its shape as it is. But we are supposed to at least wash the vulva, at least the labia, the front, and then we want to keep that place clean, so we wash just the vulva. It is advisable that even when you are washing the vulva, you don't even insert your finger inside, because your finger may be contaminated and you may introduce some bad bacteria, which would also get you some form of infections. That is true. The fact here is, do you even know the source of the water that you are using to wash your vulva? Do you know whether the water you are using is contaminated or not? I heard other women say that I even use warm water. Does it mean that if it is warm water, it is free of all forms of bacteria and other forms of infection? Somebody said that I add salt, and I asked the woman, "What are you doing a stew inside there?" That you should. I asked, I'm only asking, and then, so once in a while, every woman needs protection. You need to protect that part of you because we are exposed to this sort of infections everywhere you go, wherever you sit. I mean, the WCs that you use, you are always going to have one form of infection or the other. So it is important that once in a while you treat. Now, if you're going to treat, what are you going to treat with? Definitely, you would have to put something there, or you have to take some tablets. And some of these tablets that you take, or some of these things that you eat, you put in there, rather go to disturb the acidity or the protection of the place, and ends up exposing you to more attacks by unfriendly bacteria and other agents that will affect you. So it's important that you look for the right sort of things that you use. And I tell you, if you really search, you can find them. We are saying that you should not use douches because douches and irritants actually cause problems for your private part. Soaps or certain lotions what give you such problems, dryness. We are also saying that tampons and some types of underwear, especially when they are not cotton. And these days, all of you are wearing the G-strings, and then I hear there was a campaign that women shouldn't even wear panties. There was a lady who was spearheading that, and I was saying, wow, probably not in our part of the world, because in our part of the world, we are always exposed to one form of dust or one form of infection or the other. And then we also use contaminants or things that are contaminated, and then some even sexual lubricants are not too good for the place. And then we hardly maintain the natural balance of the place. So we use certain chemicals, and certain medicine that we are given from the hospital also ends up messing up the acidity of that environment, and all these can lead to dryness. There's one thing that women should also understand, that breastfeeding can also lead to dryness. Like I said last week, when you're breastfeeding, you can also get that problem. And then, Auntie Seto said today, poor foreplay can also make the woman dry, not wet enough, and ready for penetration. And then also, inflammations, like I said, can also cause this to happen as well. And then, when you have surgeries of the ovaries, you can also have such problems occurring. So it is one thing that everyone should consider, one thing that everyone should look at. All right. Now, certain immune system disorders can also cause vaginal dryness. We should all take a note of that. And then some also, you can have yeast infections. All those things can also cause sore in a private area. That can also lead to this problem. Now, side effects of some medications, some histamines, some people who have asthma who take these drugs can also have such problems. Some anti-estrogen tablets, medications can also cause this dryness to happen, and it's very important that we look at this. Whatever medicine that you are being given, it's important that you look at it. Now, emotional and psychological issues can also cause this vaginal dryness. In the same way, you can also have some physiological issues also causing the vaginal dryness. So it's important that you take a look at all these things. There are other things that can also cause vaginal dryness. Smoking, Smoking, you can see the lady who is heavily drunk lying on the table and dropping. And then over exercises can also cause vaginal dryness. Some of the things that can also cause vaginal dryness include cancer treatments. Cancer treatments can also cause vaginal dryness. And then also contraceptive pills. Contraceptive pills or birth control pills can also cause vaginal dryness. And I'm saying here that cigarette smoking can also cause vaginal dryness, and even cause the smell and the taste of the vagina to become different. If you smoke, the vagina tastes funny, it tastes sour. So you should note that. Alcohol also does that. Alcohol also dehydrates the body, especially those who take hard liquors, hard spirits, and all those things. It also causes vaginal dryness. So if you do not know, and you are somebody who is into a lot of alcohol as a woman, you can experience vaginal dryness. And then also too much of exercises. If you over exercise, you can become dry. So you can tell that most athletes, those who are into professional sports and stuff, they become extremely dry. You can ask them, they'll tell you. All right, so, and then some sensitivity to some allergic reactions or yes, can also cause some of these problems. Now let's look at some other causes. Some STDs can also cause vaginal dryness, like the gonorrhea, the chlamydia, urinary tract infections, like the kidney infections, pelvic inflammatory diseases, and then some pregnancy problems and when you have newborn babies, these things can also cause vaginal dryness. And then also when you have, like I said earlier, urinary tract infections. Now this is sort of a summary of all the things that you can experience when you have these things. It means you're definitely going to have vaginal dryness. Fatigue, regular headaches, muscle aches, weight loss. You have rashes on other parts of your body. These are all signs that you're having vaginal dryness. Can you just imagine you having a headache and having dryness down there? There's so much. The woman is so complex. So all these things are symptoms. Menopausal and premenopausal time would also lead to vaginal dryness. You should take that. Premenopausal, menopausal, postmenopausal can all lead to losing of estrogen, and this can also lead to vaginal dryness. And then also irregular, unusual bleeding and blood spotting, which will be some of the next things we'll be talking about, are all signs or causes of vaginal dryness. Now, just some little ways. How do you prevent them? How do you prevent yourself from getting vaginal dryness? You have to refrain yourself from using irritants or products such as douches. You have to stop yourself from using those things. You also have to avoid using condoms that are made of N9. Those are chemicals that some people or most people react to. It causes dryness in the vagina. So some condoms can cause vaginal dryness. So you should watch that too. And it is also important to understand that as you age, some of these things happen. And then when you don't exercise the vagina, when you don't do vaginal weightlifting, I started training people already on that. I have at least 5 people who are doing so well. Yes, today I spoke to one of them and she said now she can walk with the egg in her. Yeah. Stella baby. I said Stella, nobody knows who she is anyway.
Of course, there are so many Stellas.
Yes. All right, so she says she can walk with the egg in her and she's still fine. So vaginal weightlifting, all these things keep the place well, they keep the place lubricated, and then you don't have vaginal dryness. And then she said, you're wearing of cotton underwear and the loose fittings. Sometimes we wear so much tight clothes, it's all pumping, what did you to everywhere, so close, and all these things can cause you to have some form of dryness and all that. So you should wear loose clothing, especially cotton, and allow air to pass or circulate properly around the genitals, and that would also enhance healthy bacteria to grow or prevent unhealthy bacteria from thriving around your Queen's palace. And then also you should expose yourself to the sun. I said that last week. Auntie Soto was saying, so how are you going to do that? You want me to teach you how to do that? Okay. No, I won't teach you that. You see, when you say some of these things, when you do it well, you see the skin of the labia talking. It will be moving, it will be dancing, it will be absorbing the vitamin D. And it's amazing if you use a mirror to watch. If you do it well, you use a mirror to watch. It's amazing. It's really, really amazing. So we can talk about that behind the scenes, because I don't want people going to stand in the what do you call it, on the compound house and showing their stuff. They'll say, I don't want that stuff. All right, so we can do it. Now, what are some treatments? Yes, there are some lubricants. There are some lubricants and creams that you can use in treating. And then some people, when it gets to the extreme, so it becomes extremely dry, you have tried all the natural remedies, it's not working, you need probably a topical estrogen tablet, or it comes in a form of a suppository, or it's even some form of a ring that you insert. But these ones you need to see your gynae to guide you, because when you overdo it, it may cause some harm to you, because when you have too much estrogen in the body, it's not too good for even a woman as well. You shouldn't have too much of it. And then also you can eat food made from soya beans. Anything made from soya beans. They have that stuff in there that enhances the body's production of estrogen. So once you have any meal that is full of estrogen, that is pretty good, because like tofu, like soya milk, all these things, or whole soya, they improve the estrogen levels of the woman. And also, if you overfeed a man with soya, you know what it does? I won't tell you. And then wild yam, there's research saying that wild yam also allows a woman to have enough estrogen and stops the vaginal dryness. Yes.
Normal yam.
Yes. I do, yeah. But you see, I wrote there that I don't have enough scientific evidence to show, but there's a lot of people tell me that yam is good for that purpose.
Okay.
Now I would want you to watch this one.
Of premenopausal women. Vulvovaginal dryness is a condition whereby the external genitalia and the vagina become dry, thin, pale, fragile, and actually becomes vulnerable to trauma, infection, and even bleeding. The most common cause of vulvovaginal dryness is low estrogen at any stage of a woman's life. Estrogen, if you will, is the life force of the vagina and the vulva. It promotes the production of glycogen, which is a substance that the good bacteria lactobacilli thrives on, and which in turn keeps the vagina in a healthy vaginal pH. It also promotes production of mucus, the increased blood flow. It makes it elastic. When the estrogen levels are low in a woman, usually in the postmenopausal stage, but it can happen in other stages of life, all of those good things become reversed. And what happens is you see these nice little ridges here in the vagina. Those are called rugae. They flatten out and the vagina comes thin. The blood flow decreases, so the vagina becomes pale. The tissues lose the glycogen that I spoke of, and the good bacteria aren't there. The pH goes up, and women lose lubrication and moisture. The same with the vulva. The vulva has estrogen receptors as well. And the estrogen at the vulva keeps the skin, like skin in your body, it keeps it very healthy. It increases collagen in the skin, subcutaneous fat. And when the estrogen levels are low, these qualities are diminished. So women notice that there's thinning of the tissues, hair loss, and just very vulnerable. The tissue becomes very fragile. The symptoms of vulvovaginal dryness, and which eventually long-term low estrogen can lead to atrophy, are varied. But some women present to me just with vaginal itching, or they notice that they're very dry or don't lubricate during sex. And this has a tremendous impact on female sexual function. In fact, the leading cause for female arousal disorder is vaginal atrophy. and it can impact one's self-image, one's self-esteem, and overall quality of life. But vulvovaginal dryness doesn't just affect older women. 15% of premenopausal or reproductive age women also suffer with vulvovaginal dryness. The important thing is that women address this problem. Over 60% of women are afraid to address it, and many providers fail to address it as well. I've had patients come in, and until someone asks, I say, how are you doing? How's your relationship? Are you sexually active? And one patient recently said to me, oh, doc, I am dry as sand down there, which really says it all. Vulvovaginal dryness can make women feel old. What are other causes for vulvovaginal dryness? It isn't just menopause. Women can have low estrogen at various stages of their life. They can be breastfeeding. They can just had a baby where all the hormones have gone way down after being pregnant. They could be on anti-breast cancer medications that are anti-estrogens. They can have be on chemotherapy. They can have been exposed to pelvic radiation for pelvic cancers. Certain medications can cause dryness, even non-specific antihistamines. There's some birth control pills that are only progestin pills or progestin birth control, and they don't have estrogen. And I've noticed over time that women are on these a long time may know that they have decreased lubrication and suffer with some vaginal dryness. There are even lifestyle factors that come into play that can aggravate dryness. Smoking, excess alcohol, lack of sexual activity, and even obesity can impact the vulvovaginal area. I encourage women to speak to their doctors or their GYN providers about vulvovaginal dryness, and if long-term left unchecked, it becomes atrophy. There are numerous remedies for this. We have over-the-counter lubricants that can aid women during sexual activity and help with lubrication. There's also moisturizers that they can use externally, and then there's also a number of localized estrogen therapies which work very effectively, because if you're lacking estrogen and you give it back locally in that area, it works wonders to restore vulvovaginal health. And these come in many forms. We have rings and creams and tablets. So please, this is not a condition that women should suffer in silence. There's terrific remedies out there to improve your overall quality of life.
A personal gynae friend of mine in the US, and then I'm telling you, we have solutions for this problem. If you have vulvovaginal dryness, there's solution. Yes, stop inserting the garlic and the ginger and the onion and the mentia and doing the stews under you. All those things won't help you.
Yeah.
They won't help improve your situation. They rather make your situation worse. So if you have vulvovaginal dryness and you need help, Evolution, we are there. But just call me 0244 66 10 11, 0244 66 10 11. We get you some stuff to use to fix that vulvovaginal dryness that you're experiencing. Now, to today's subject, we're talking about vaginal discharges. What is vaginal discharge? Normally, vaginal discharge is simply just fluids that exit the vaginal opening. They are just fluids that exit the vaginal opening. But you see, these fluids, they come in, they're actually secretions from the vagina or secretions from the cervical mucus, right? They are either secretions from the vagina or cervical mucus. And the amount of this discharge varies from person to person. So some have lack of lubrications, others have little. You remember when we're looking at the face, the eye, and I said when the person has moist eyes, the person lubricates well, and when the person has wet palms, the person lubricates well. So if you're a student of adults class, you know this one is already set there. And then also we have normal discharges, and normally those normal discharges are either white or clear. They are white or clear, and they become a little stretchy or slippery during ovulation period. Normally 2 or so weeks before your menstrual 2 or so weeks after your menstruation, the body sort of lays a trap for the sperm that you lay. So once you put the sperm inside there, then it will trap the sperm in there, and you can keep it up to 5 days. So if those cervical mucus are released, before ovulation, and your sperm is introduced there, the sperm can be hoarded for 5 days, and when you ovulate, the sperm can impregnate you. So if you tell me he had his menses this time, and then we had sex, and his ovulation time is that, the sperm can be hidden inside the woman for 5 days before and after ovulation. Mind that. You should know that. So if you don't want children, get married. If you don't want to have children out of marriage, get married before you start having sex. Very important.
Or
very,
you
very
just
important.
use condoms.
No, don't use condom. Condoms can break. Get married before you have sex. Okay, so the thing is, there are times when a change in amount of discharge, right? The change in amount of discharge can be a symptom that shows that there's some sort of an infection or the other. And then you should be very observant of yourself. You know your own private area. You know your own queen's palace. So you should be able to observe it. And when people do not pay attention to that area because they have been told not to touch it, personally, it annoys me. It is your own thing. It's your own private area. If you don't know what is there, if you don't touch it, if you don't observe it, who would do that for you? Some even have discharges that foul odor, and they don't even know because they have been told not to touch, not to even look. And I hear they say it's a sin. You have your own thing, you are looking at it, it's a sin. You are touching it, it's a sin. Forgive me. Just touch it and pray for forgiveness, okay? The thing is, you should observe yourself. You should know yourself before somebody can know you. It's very important so that when you have some of these, abnormalities, you would be able to tell where it's coming from and what the causes are, and then you can quickly seek for help so it doesn't become, worse. So anytime there's any upset in the pH balance of your queen's palace, you start having problems. And the pH of the queen's palace is between 3.5 and 4.4. It is very acidic. So if there's anything that would change that structure, that would change the pH, it really comes with a lot of problems for the woman. And sometimes people don't know. Andy Sato was talking about oral sex. Oral sex can also give you some form of infections. And the easiest way to get yeast infections or some bacterial infections is to go and eat your fried rice and your pizza, and then right after that go into love making and go and have oral sex. It will introduce that food you have eaten in your mouth into that private area, and that private area doesn't like fufu, doesn't like pizza. Some men will not even clean themselves well after all the sweat, after the day's work. They get a woman, they want to have a quickie, and then bam, they do it without cleaning their private tool. That also can infect the woman.
It is very serious because you use the toilet.
Yes.
It's not.
Yes.
It's to me to see
all forms of infections.
And then it need be seen best here. Maybe a hound. And you know, sometimes at the end of the day, they feel they miss your phone.
And then they go around bashing the woman, and now sent Kakawa no home, and she's unpleasant, she's a little too slippery or too wet, simply because you have infected him with the pizza and the fried rice and then the jollof rice and the what do you call it? I confirm that you went chewing. So the ideal thing, we'll be talking about oral sex into more details as we go on. The ideal thing is after eating, you gargle. You use water to gargle.
Just brush your teeth.
Brushing your teeth can also cause a problem because if you have gum bleeding,
then we aren't safe.
The thing is, if you have gum bleeding, when you brush your teeth and you have a bruise, and the person has an infection, it's so easy for you to get. When you use mouthwash and the mouthwash gives you cuts on the tongue, and you go doing oral sex, you can't get infected. So the best thing is to use something that is minty, something minty to clear the mouth, something minty to keep the odor of the mouth fine, and then make sure you use water to remove all the food particles you have in your mouth before you get in there. That is why it is not even healthy to get into bed right after eating. Wait some 30-40 minutes before you start, so that everything in the mouth would have then gone down into the body. I hope you understand what I'm saying. It's very key that you learn this thing. Now I'm showing you this. You can see some discharges. These are normal discharges, but you see, when you insert your finger, this is something I didn't want to show, but I have to do it. When you insert your finger under you, probably after your menstrual cycle, and you feel this thickish, very thick mucus, it simply means that you're not fertile. That's not a time where you're ovulating. Right? You're not fertile. And then if it is creamy and sticky, it also means you're not fertile. But when it is cloudy and slight and very stretchy, it is cloudy, very stretchy, it means you are somehow fertile. And then if it is like the egg, when you remove the yolk, the egg white becomes watery, it means you are very fertile. When you insert your finger and then it becomes very stretchy, and when you opening, it doesn't break, that means you are very fertile. So it is something that you should know. And once you are seeing these discharges, don't think that they are bad and you go and put onion and garlic and ginger to go and cook some soup there.
So it's okay to have discharges of this sort?
Yes, these discharges are normal discharges. They are normal discharges. But if they turn into milky and cheese-like, yellowish cheese-like, then it becomes a problem. So as we go on, we'll be learning. I mean, this is the adults class. I keep saying it's the most educated adult, the most educative. Is it educative or educated? Most educated adult show in the whole of this country, Ghana. We do real things. We don't do that, you know. Anyway, so anytime you're experiencing any unusual discharge during your menstrual period, you should look at it, because the menstrual period is a very important part of you, where the endometrium just washes down and then allows more of your body to recuperate itself. You know, lubrication becomes okay after that. So if you see some little discharge that is a little brownish, a little reddish right after your menses, okay, it shouldn't cause any alarm. I mean, I'm saying that normal discharge should be clear, maybe thick or thin, depending on the type of your menstrual cycle. You should see it. So don't be so worried when you are seeing something sticky. And then also, like I said earlier, the amount of fluid that comes out depends or varies from person to person. But the only time that you should be alarmed is when you're feeling burning sensations, when it is itching, and then when it is what do you call it? You immediately feel the burning sensations, and you feel the irritations, and then they are coming on continuously. You should quickly seek for help. And like I said, there are a lot of products you can use to solve these problems. All right, so what are the possible triggers of vaginal discharges? The use of antibiotics, because antibiotic is supposed to kill bacteria. So when you use antibiotics, it will kill bacteria, whether healthy or unhealthy. Whatever it is, it will clear it. So if you continue to use antibacterial, all the healthy bacteria you have in your Queen's Palace will be destroyed. And once they are destroyed, you are exposed to all forms of attack, because it is that acidic nature of the place. It's those bad lactobacillus bacteria in there that protects you. So once you get rid of it, you are exposed to foreign invaders, and then they will invade you like no one's business. And then also, like I said, birth control pills can also give you some form of discharges. So if you don't want to give birth, there are natural ways of doing it. But it is best when you are married, you make love, you have your children. If you want to control, just learn to control, learn to use a menstrual cycle, and then men learn to stop ejaculating, and then you have children that you don't want. you have done that already, you know. You don't have to be ejaculating all the time. When your wife is not safe, you don't have to ejaculate. You can still make love, have your orgasms without ejaculating. I've already taught you that, and I don't think it will be new to those who are watching this show for the first time anyway. But you have already gone past that. Anyway, so we are here. So don't douche, because douching can also give you what do you call it? And then those who are diabetic can also have vaginal discharges, because I mean the cells just misbehave, and people who have diabetes or diabetic people have cells misbehaving, and then there are products, like I said, if you're a woman, we have products that we can use in correcting this one. During pregnancy, hormones become very, very funny, and you can also have some discharges. But if you're having some discharges and then they have foul odor, please seek for help, because the foul odor doesn't come. When you become stressed, you can also have some discharges. And then also, when you're wearing some tight and then synthetic underwears, like those who are doing the G-string deep down there, you are disturbing yourself with this thing. And then these days they have the feminine hygiene spray, and then they'll pick the spray and then they'll hey.
Not on going side, Anna. Just outside, right?
It is interesting. Maybe you spray it outside. Somebody will just that's the feminine hygiene. So we just open the Queen's Palace and pump it in. So those sprays can also cause some problem with the pH of the place. Some of you may even disturb the Bartholin gland, and then you have some bad. And then certain soaps can also cause you that problem. And anytime the discharge is abnormal, it is either greenish, it is yellowish, it is chunky, and it has some sort of consistency and a foul smell, immediately we find you some help, because then you are having a discharge that is not normal. Okay, so there are several types of discharges. Soon we'll be activating the phone lines, and then we'll become very interactive with you. So the phone line will be out there for you to call. We'll read your text messages, so keep the messages coming. And don't forget that we are keeping the sex positions for the last. So we'll be ending this class soon, so we can be able to become interactive, you know. And then if you have a friend who doesn't get this show, it is on GNTV Ghana Networks. You can watch it live. You can also go to the adults class page on Facebook, and then by tomorrow morning when you get to my YouTube channel, Papa Kwamna Mr. Smooth, you'll find this one there, because I have somebody who is going to sleep and do it. Sleep overnight and have it done there. So we are here still. So we are talking about types of vaginal discharges. We are saying that there are some types of discharges that are normal, and there are others that are abnormal. Now we are saying that if it is white, like I've already said, the whitest discharge are normal. But if it is itching, if it is thick, if it has the cottage cheese like look, consistency or appearance, it means you have a yeast infection, and you quickly need to seek help. And there are some good remedies that you can have immediately. Yeah, do a little expensive, but they are good for you. And then yes, because your Queen's Palace is expensive, it's not cheap. And then clear and watery discharge, you also have to check that one. That is also a type of discharge, and it's not always that it's not good, but immediately you start feeling the discomfort that I'm talking about. And if it is as a result of heavy exercise, after exercising for a long time, you start experiencing that, quickly seek help, because that is not a good one. That is not a good one that you are having. And then when it is clear and it is stretchy, I told you that it is from the cervix, from the cervix, and it's just a sign that you are about ovulating, so you shouldn't worry. But if it is yellow or green, then it has an unpleasant smell, then you're having tricho. And these are sexually transmitted illnesses or sexually transmitted diseases that you can get through sex. So once you experience the yellowish or greenish discharge, sometimes brownish, quickly seek help, because then that discharge is not normal. Now If the discharge is pale yellow or it is colorless or it's accompanied with symptoms like that can cause you yellow discharge include, I'm saying symptoms that can cause you yellow discharges include trichognomiasis. Hey, Charlie, doctor, so bad. What I do? And then this one will make you itch. It give you painful. It is painful when you are urinating, and then also even when you're having, it's like having some sort of pathogens or stuff inside you. You feel like there's something moving inside you, and surprisingly, this one can also be contracted through sharing towels and bathrooms. So even when somebody has it, a person use a towel, and you go and use it, you can also get it. So you are warned. And then chlamydia is also one of the things that you can also get. And when you have it, you also have that yellowish and greenish discharge. These are things that you should also be aware of. There are some discharges. I'm showing you, this is a yeast infection. This is the way it looks like. This is a yellowish infection. I'm talking about yellowish discharge. I was talking about, this is the way it looks like. There's another yellowish discharge that you find is like some cream that normally you wear your panties, you see it on. And then also this is a brownish discharge that Auntie Sato mentioned not long ago. And then you have this one that comes normally before your menses. This one is normal. It's not bad. And then this one are spots, red spots after your menses. Or you see all these kinds of discharge, you need to pay close attention to it and seek help ASAP. It's very important that. All right, so signs that the discharge you're having is bad. Signs of a bad discharge. So signs of a yeast infections. These are signs of yeast infections. You have white cottage cheese kind of discharge. It is smelling. It is spinning around the vulva. It is itching. It simply means you have yeast infections. So when you have this sort of signs, it's straight up you have yeast infections. Now, painful intercourse is also a sign that you have yeast infections that you need to treat. And the signs of a bacteria vaginosis, you have white or gray or yellowish vaginal discharge. This also shows that you have bacteria vaginosis. And then also it has this fishy odor. I'm sure I mean somebody's already touching the nose. And then it has have this watery, yellowish, greenish, bulby. All right, so the unpleasant odor also comes with it, and it also comes with pain and itching. Our wonderful friends in Mary Ghana or in Mary Global, to Foster, to Godfather, to Fred Mensah, to Victor, to Josh, the big boss, Josh, and then to Claudia, I won't forget you, Claudia. Tell grandma I love her. And to all my wonderful family and friends all around the world, and to all my fans, keep watching the Adults Class.